South Africans have seen the samples being taken, and they've seen Health Minister Zweli Mkhize announce COVID-19 test results. But what goes on between that? From swab to result, this is one of the labs conducting tests for the coronavirus. More than 1,000 such tests are conducted every day. Sophisticated machinery, harnessed by some of South Africa's top medical minds, are doing their bit to fight the spread of the disease. They're the frontline workers the public don't get to see. But they play an equally vital role in the fight against the disease. Daily, they handle thousands of samples containing the virus that has brought the globe to a standstill. The testing process starts with the delivery of samples. They're sorted at a designated COVID-19 station.
This is what we get from them, and then we have to sort them in the batches that we're going to process for our extraction instruments. So we process them for 94 and 70, depending on the instrument we're going to use, right? So this is the labor-intensive part, and also it takes a bit of time to process. It takes about an hour, 1.5 hours to prepare one batch.
Extraction is the process of removing a sample from the swab. It's then prepared for the testing machine to identify traces of the virus if it's present.
We then prepare our PCR reactions. The PCR reactions is a mixture of various components that will allow us to detect the virus nucleic acid material, and that then gets combined with the patient nucleic acid material. We then put that mixture of your template, or as we call it, which is then your patient nucleic acid extract and your PCR components, into a real-time PCR instrument, which then gives us, after 2 hours, the results for the PCR process or the PCR test. Those results are then being analyzed, and our pathologists then authorize those results so once it has been placed onto our laboratory information system.
In another lab, which is 90% automated, machines used to test for HIV now also test for the coronavirus. Skills and ingenuity were put to the test.
3 weeks ago or so, they developed all the assay for COVID on these instruments, got emergency approval. So we were given the task to validate the assay and get it up and running in this lab. So at the moment, we're still processing our HIV viral loads, and then we're also running COVID samples as well.
The global pandemic has placed new demands on the staff here. They work long hours, but have grown as a team.
It's become very close to people, very real. They see what the outcome is, and I think that drives people and motivates people to work a little bit harder or a little bit longer. Yeah, but there's exhaustion, definitely. Yeah, we're all tired.
As more technology becomes available, testing capacity will increase, and making it possible will be the men and women in their white capes and masks. Barry Bateman, Johannesburg.